Good morning and welcome to the RHTP AFA release webinar. This is Sharon Covert and I am your program manager for the Health Prosperity Pillar. This slide shows the rest of our team, including Dr. Carrie Jeffries, the director of the RHTP program in West Virginia, and Dr. Arvind Singh, Secretary of Health. The agenda includes the welcome, which I am doing now, and then we will cover the announcement for funding availability opportunity, which is restoring West Virginia's workforce through health to work programs for substance use disorder, including the goal of opportunity, the types of activities supported, the solicitation type, and the attended applicants. And we will cover the application process, the last part. Our overview of funding opportunity is the Health to Prosperity Pillar, which connects recovery, care management, and employment programs to help West Virginians overcome health barriers to workforce participation. This initiative supports economic productivity by helping adults with chronic conditions and behavioral health challenges return to work and move towards employer-sponsored coverage. I'm your program manager, Sharon Covert, and this year, in the first year of the program, we will be allocating $13.4 million. The CMS goal alignment is to make rural America healthy again, and the key stakeholders are listed in the bottom left-hand corner. As you all may or may not know, West Virginia has the lowest participation rate in the workforce at 54.3%, and the number one reason for people not working is reported to be poor health or disability. The key pillars and outcomes are to help West Virginians get back to work and keep people healthy and at work. And the outcomes we hope to achieve are increased number of individuals supported back to work through the workforce and participating programs. We are hoping for at least a 6-month job retention rate, an increase in the labor force participation by 2% over the next 5 years, and a decreased rate of employees who leave employment due to chronic health conditions. Again, this is restoring West Virginia's workforce through health to work programs for substance use disorder. And the scope of the award supports the creation and expansion of integrated recovery to work programs for individuals facing employment barriers due to behavioral health conditions, including substance use disorder under the Health to Prosperity Initiative. The scope includes bridging clinical treatment, peer recovery support with direct job placement, vocational training, and long-term retention services to ensure sustainable employment success. It's the Health to Prosperity Pillar and helping West Virginians get back to work. This announcement of funding availability is for $2 million that must be spent by July 31st of 2027. It's a competitive announcement of funding availability or a grant with no required match. And eligible applicants, please pay attention, include nonprofits, health systems or provider affiliated groups, state universities or colleges, workforce or employment support organizations, regional or community-based organizations with demonstrated employer engagement capacity. The vendor must provide information and documentation regarding how the solicitation will track and report the following metrics. All have a baseline and target, and those numbers will be based on a negotiated contract with the state if you are awarded. So we want to increase the number of individuals supported back to work through the participating program for at least 6 months or 180-day job retention, decrease the rate of employees who leave employment due to health conditions with a focus on behavioral health and substance use disorder. Program utilization and service metrics include the number of additional participants actively enrolled in return to work services, defined as individuals who have completed intake or receiving liaison-led coordination during the reporting period. The time from the first return to work liaison and the actual return to work, the median and average, and the number of participants placed in a competitive employment or educational vocational training program during the reporting period. We're looking for the number or percentage of people at 30, 60, 90, and 100-day retention, the number of employers actively engaged in return to work cases, which is defined as employers participating in new hiring activities for target populations or return to work planning, accommodation discussions, or verification activities during the reporting period, number of active recovery-friendly employer partners, and any site visits conducted by liaisons or peer recovery support specialists, The number of additional referrals and associated rate of completion or adherence coordinated through care navigation, including but not limited to referrals to primary care, specialty care, therapy programs, rehab, Community Alcoholics Anonymous, Narcotics Anonymous, or Cocaine Anonymous. The application process has not changed if you sat in on prior webinars. All of these 4 parts need to be included. They all need to be complete, and they need to be organized as they are laid out on this slide. Please understand this is a very important slide. The narrative must be organized by the following sections: your capacity, impact of the project, feasibility and implementation, long-term sustainability, and that's a revenue model post-grant with funding commitments from partners and or an industry. A detailed budget and the narrative. We'll provide the budget form, and you need to provide a narrative that explains it. So if you're asking for $100 in mileage, we need to know how many cars will travel how many miles, at what amount, what rate of reimbursement, how many times. The target funding budgets will be processed via email for the 2026 fiscal year, and allocation amounts are subject to the appropriation and availability of state and or federal funds. So you don't get the money until we get the money. The grantee contact list should be complete and contain at least 2 contacts. We do not assume responsibility to maintain or copy alternative contacts. These are the components of a successful program: an operational readiness plan that shows your ability to hit the ground running, workflow, staffing, partners, tools, and timelines. And you're going to see that in the first and last entry on this slide. Speed to launch. You need to demonstrate that you can begin and deliver on early milestones according to the AFA. You need to be able to integrate with the state data system, provide long-term sustainability plan, the accountability to meet state milestones and metrics with mechanisms to monitor progress, address underperformance, and meet state and CMS performance expectations. Show fiscal stewardship on how you will complement rather than duplicate existing or reimbursable services, and do not replace existing funding or staffing. You should demonstrate readiness to manage grant funds responsibly, including line item budgeting, financial reporting, audit readiness, and compliance with the state and CMS. Show ability to stand up and run the program using a concrete operating model, including workflow, staffing, partners, tools, and timelines. Describe your recovery to work model, detailing how you will integrate clinical treatment, recovery supports, and employment services for people with behavioral health or substance use disorders. Outline your strategy for engaging a network of employers. They should be recovery friendly and provide evidence of these partnerships. Something as simple as an MOU will do. Detail specific roles of your return to work liaisons or peer recovery support specialists. Explain how your program will address non-clinical barriers such as housing and transportation. Find the opportunity on the West Virginia OASIS vendor self-service portal using listed under grant funding opportunities. Determine your eligibility, submit the application, and wait. Announcements will be made this summer. Before submitting, verify you have every required component and each component is complete and meets the rules for page limit, type, file type, etc. Make sure your narrative is organized exactly as required on the previous slide. All required attachments are included. The file name is clear and consistent, and run a quality check for simple things like spelling. We encourage everyone to submit early because we do not accept late or incomplete applications. So 24 to 48 hours is your target before the due date. And you can't submit like other parts or pieces that you may have forgotten later. So take your time. There's a Q&A form on the Department of Health website for this solicitation. Only one complete submission per organization can be made. Questions must be asked in 3 business days of the announcement, which is tomorrow, July 30th or July 9th, and answers will be posted on OASIS. This is the information again about the initiative, which is Health to Prosperity, Restoring West Virginia's Workforce Through Health to Work Programs for Substance Use Disorders. It's an AFA. Deadline is July 20th, and questions are due July 9th. These are some more websites on the OASIS VSS portal that you can use for assistance. And this is what the portal looks like once you get in to navigate it. The welcome and login, the FAQ to use the portal, and the vendor self-service. We usually get 30 to 50 applications, so there's a high volume. It takes a lot of time to review each one so that we can assure everything is reviewed fairly and thoughtfully. Applicants should expect to receive award decisions this summer, and for selected applicants, an award will be created and agreement will be sent for signature. Thank you so much for your patience as the state reviews a high volume of applications. We appreciate your interest and look forward to potential future partnerships.